Paleo diet better than American Diabetes Association diet for type 2 diabetes. A just published study comparing the American Diabetes Association or ADA diet with a hunter-gatherer or Paleolithic or Paleo diet shows far better blood glucose control and improved insulin sensitivity on the Paleo diet. Metabolic and physiologic effects from consuming a hunter-gatherer or Paleolithic type diet in type 2 diabetes. 25 patients with type 2 diabetes. 50 to 69 years old patients were randomly assigned to the Paleo or ADA diet. They ate a ramped-up diet for 7 days, then the test diet for 14 days. The Paleo diet consisted of meat, fish, poultry, eggs, fruit, vegetables, tree nuts, canola oil, mayonnaise, and honey. Foods excluded were dairy products, legumes, cereals, grains, potatoes, and products containing potassium chloride. Some foods were not typically hunter-gatherer food, like mayonnaise, carrot juice, and domestic meat, but contained the general nutritional characteristics of pre-agricultural foods. The diets were divided into 3 meals and 3 snacks, all prepared by the research center kitchen staff. The diets contained enough calories, so patients lost no more than 3 pounds. If they did, calories were increased. The primary outcomes for this study were change in insulin sensitivity and improvements in lipid profiles. Total cholesterol, triglycerides, and high-density lipoprotein cholesterol. Blood pressure was also measured. Here's the actual breakdown of diet eaten for the 14-day test period. What is interesting is that the diets were matched for calories and macronutrients. Notable is the carbohydrate content for both diets. Not at all low, carbs are around 400 grams per day. Previous studies of paleo diets compared to standard diets were naturally lower in carbohydrates, so this study adjusted for that. Lipids or cholesterol. There were statistically significant reductions in total cholesterol, HDL cholesterol and low-density lipoprotein, LDL cholesterol on the paleo diet. The total cholesterol, HDL cholesterol, and LDL cholesterol trended downward on the ADA diet, but only the decline in HDL cholesterol reached statistical significance. The triglycerides trended downward to a greater degree on the paleo diet than on the ADA diet. Changes in insulin resistance. Fructosamine, a marker of blood glucose control, reduced by 34 micromole per liter in the paleo group and only 3 micromole per liter in the ADA group. Insulin resistance improved more in the paleo group, and those with the worse IR at the start improved the most. The diets were very similar, except the source of carbohydrates in the paleo diet was different from fruits, vegetables and honey. The ADA group ate rice, bread, and pasta as recommended. There was a significant difference in fiber content of the diets, about 35 gram per 2,500 kilocalorie in the paleo diet vs 12 gram per 2,500 kilocalorie in the ADA diet. It is possible the fiber slowed the postprandial glucose rise, and that this was the main driver improving overall glucose control. There has been criticism that the ADA diet should have been high in whole grain carbohydrates with more fiber. However, people following ADA diet recommendations would typically choose similar grains to those provided in this study. The paleo diet is naturally high in fiber when choosing the recommended fruit and vegetables. Another reason the paleo diet may be more successful than the ADA diet is the type of carbohydrate. Fruit and vegetables have starch contained in cells, as opposed to granular starch. This has a beneficial effect on gut bacteria, and recent studies show gut bacteria type is linked to type 2 diabetes. Microbiome associated with type 2 diabetes and its related complications. Comparison with ancestral diets suggests dense cellular carbohydrates promote an inflammatory microbiota, and may be the primary dietary cause of leptin resistance and obesity. If you have type 2 diabetes, simply switching to a paleo diet of meat, fish, poultry, eggs, fruit, vegetables, tree nuts, olive oil, avocado, and even a bit of honey. And eating as many vegetables as you can manage is your best bet to manage it. Thanks for watching this video. This video presented by http://type2diabetesreducer.blogspot.com